You have the power of the purse here.
Thank you.
Know that.
Thank you for reiterating that, but I think that I'm not sure the administration really has internalized that, particularly Mr. Vogt hasn't internalized that when he says that we can in fact, impound money. The money is there. The 2024 budget includes the funding for the NIH. Will you commit to spending the money that is in 2024 in that budget?
As I said, Ranking Member, if you appropriate the money, I'm going to spend that money.
Representative Rosa DeLauro opened by challenging the way Secretary Robert F. Kennedy Jr. has publicly discussed measles outbreaks in the United States.
The Ranking Member, Ms. DeLauro.
Thank you very much, Mr. Chairman. Let me just one area of correction, which has to do with the measles issue, Mr. Secretary. You keep comparing the U.S. to other countries. You compare us to Europe, but the Europe you are referring to is the WHO European region. That's 53 countries in Europe and in Asia, including those with low vaccination rates like Romania that has never eliminated measles. If you compare us to Western Europe countries that we often compare ourselves to, like Great Britain, they have seen no measles death this year. Let me move to the NIH. In your testimony, you say you want to quote, and I quote, rescale our biomedical research budget, unquote. Excuse me, but that's BS. You are not rescaling NIH research. You are proposing to cut it by $20 billion. And according to our colleagues in the Senate, NIH has effectively cut research funding by $2.7 billion this year in comparison to the same period last year. That's a cut of 35% during that period. That includes cutting cancer research by 31%. This is the report put out by the Senate, Trump's War on Science, which goes into detail about how we are, in fact, dealing with cutting scientific research. Mr. Secretary, are you freezing or withholding funding that Congress appropriated in 2025 for life-saving NIH research?
Let me address your first issue first, because I want to correct you. We have about 1,100 measles cases in this country. The growth rate last year was 15 additional, so we have plateaued. Mexico has roughly the same number with a third of our population, and they got 300 extra cases last week. Canada has more measles, 1,500. They have 1/8 of our population. Western Europe has about 6,000, which is 10 times the number that we have. Well, you are wrong about what you said earlier.
We can discuss that, but I think one has to consider whether or not we're dealing with decades of data proving how effective and safe the measles vaccine is. I want to move to that. I want my questions answered on, are you freezing and withholding funding that Congress appropriated in 2025 for life-saving NIH research?
We are not withholding any funding for life-saving research.
Okay. Do you commit to following the law?
Of course.
And fully obligating funding that Congress appropriated? We appropriated, it is the law of the land for NIH research, and to obligate those funds by September 30th of this year. Or are you planning to break the law by impounding congressionally appropriated funds?
If you appropriate me the funds, I'm going to spend them.
We have in the bill. You are cutting the NIH by $18 billion, or you're proposing to cut it by $20 billion. The Congress appropriated those funds. It passed into law. It's part of the 2024 budget, and we are under a continuing resolution that has adopted the 2024 numbers. How then can you justify cutting $20 billion from the biomedical research budget?
If you appropriate the money to me, I'm going to spend that money.
We have appropriated, Mr. Secretary.
Then I'm going to spend it.
Then you're going to spend it. You're not going to cut $20 billion from the NIH.
The White House proposal is to do very, very large cuts at NIH.
Well, that is contrary to the money appropriated.
Ranking Member.
Yes.
If Congress appropriates me the money, I'm going to spend the money. You have the power of the purse here.
Thank you.
You know that.
Thank you for reiterating that, but I think that I'm not sure the administration really has internalized that, particularly Mr. Vogt hasn't internalized that when he says that we can in fact impound money. The money is there. The 2024 budget includes the funding for the NIH. Will you commit to spending the money that is in 2024 in that budget?
As I said, Ranking Member, if you appropriate the money, I'm going to spend that money.
The money has been appropriated. So the answer to that is if you're not willing to accept the funds that have been lawfully voted by members of the House and Senate on the money for the National Institutes of Health. Well, I'm going to hold you to your word that that funding is there. It should be transferred from 24 to 25, and you've cut already $20 billion. Let's get that money back. Let's get that money back. You have an obligation to carry out the law and to implement what the Congress has done. Unbelievable. Unbelievable. Chronic disease and tobacco. Tobacco use is a major contributor to chronic disease and is a leading preventable cause of death in our nation. Each year, killing nearly 500,000 Americans, costing the nation nearly $250 billion in health care costs. CDC's tips from former smokers' media campaign alone is estimated to have saved more than $7 billion in healthcare costs by helping more than 1 million smokers quit. Why did you eliminate CDC's Office of Smoking and Health, an office that reduces the number of kids using tobacco products, helps order tobacco users to quit, and saves taxpayers dollars?
We have, under the reorganization, and I'm going to talk very, very broadly, because as of 4 o'clock yesterday afternoon, we are under a court order not to do any further planning on the reorganization. And I've been advised by my attorneys and not to talk about it. But I will just say broadly, many of the programs that the Democrats are now saying were cut at CDC were not cut at all. Those programs were transferred to the Administration for Healthy America. But I'm not permitted to talk in any more detail because of a court order.
I know we're just dealing with words. You transfer it here, there's less money overall for the agency, therefore there's less money for the programs. In both 2024, 2025, Congress, again, power of the purse resides here, appropriated $246 million for CDC's tobacco prevention programs. Do you commit to following the law again, fully obligating those funds so that we can help adults who want to quit using tobacco and prevent teens from becoming addicted?
Allow me to answer that by pointing out the absolute cataclysmic disorganization of this agency under your oversight for 40 years. We had 9 separate offices of women's health. When we consolidate them, the Democrats say we're eliminating them. We're not. We're still appropriating the $3.7 billion, but we're not keeping all 9. We had 8 separate offices for minority health. We eliminated 1. We had 27 HIV offices.
Okay, let me just, I'm going to interrupt.
We had 59 behavioral health programs.
I'm well over time. If you could just get us what has been eliminated, why you're doing it, and the criteria by which the elimination has occurred. That is information that this committee needs in order to be able to do our job in terms of appropriating funds. Thank you.
And we
for
will
your
gladly provide that to you, but right now we're under a court order that prohibits us from doing so.
Okay.
She said his repeated comparisons between the U.S. and Europe were misleading. The Europe he referenced, she explained, is the World Health Organization's European region, a group of 53 countries stretching across Europe and Central Asia, including nations with historically low vaccination rates that have never eliminated measles. DeLauro pointed out that when the U.S. is compared to Western European countries it usually measures itself against, places like the United Kingdom, the picture looks very different. Those countries, she said, have recorded no measles deaths this year. That distinction matters because measles is not just another childhood illness, it is one of the most contagious diseases known, and decades of data show that high vaccination rates prevent outbreaks and deaths. Subscribe now if you want coverage that explains why these details are more than just statistics. DeLauro then pivoted sharply to the National Institutes of Health, and her tone hardened. She quoted Kennedy's own testimony, where he said he wanted to rescale the biomedical research budget. She rejected that phrasing outright. She said this was not rescaling, it was cutting. She accused the administration of proposing to slash NIH funding by roughly $20 billion, According to Senate data she cited, NIH research funding was already down $2.7 billion compared to the same period last year, a 35% reduction. Cancer research alone, she said, had been cut by more than 30%. DeLauro referenced a Senate report titled Trump's War on Science, which outlines the cumulative impact of these reductions on biomedical research nationwide. Kennedy responded by first returning to the measles issue. He said the U.S. had roughly 1,100 measles cases and claimed the growth rate had plateaued. He compared those figures to Mexico, Canada, and Europe, arguing that other countries had more cases relative to population. Kennedy stated that the department was not withholding funding for life-saving research and said he would comply with the law. When DeLauro pressed further, asking whether he would fully obligate the funds Congress had appropriated by the end of the fiscal year, Kennedy repeatedly answered that if Congress appropriated the money, he would spend it. That answer, however, exposed a deeper conflict. Subscribe now if you want to understand why this matters beyond Washington politics. DeLauro laid out the stakes. Tobacco use remains one of the leading preventable causes of death in the United States, killing nearly 500,000 Americans each year and costing hundreds of billions in healthcare expenses. She highlighted the CDC's Tips from Former Smokers campaign, which has helped more than 1 million people quit and saved billions in healthcare costs. She asked why the administration eliminated the CDC's Office on Smoking and Health, a program that reduces youth tobacco use, helps adults quit, and saves taxpayer money. Kennedy said he could not speak in detail because of a court order related to the department's reorganization. He claimed many programs were not eliminated but transferred to a new Administration for Healthy America. DeLauro countered that transferring programs into a smaller budget still results in less money overall and therefore fewer resources for prevention. She pointed out that Congress had appropriated $246 million for CDC tobacco prevention programs in both 2024 and 2025, and asked whether Kennedy would fully obligate those funds as required by law. Kennedy responded by criticizing what he described as decades of bureaucratic disorganization at HHS, citing multiple overlapping offices that he said needed consolidation. DeLauro cut him off, noting that she was over time and requesting detailed documentation on what programs were eliminated, why, and under what criteria. She emphasized that this information is essential for Congress to do its job and allocate funds responsibly. The exchange ended with frustration still hanging in the air, unresolved questions about funding, and a deeper concern about whether scientific integrity and public health priorities are being undermined by budget decisions and messaging. If you want continued coverage that breaks down these hearings and explains what they mean for public health, research, and trust in government, make sure you subscribe.